I think I've been really blessed to have been exposed to the practice of medicine from a very young age because my dad is actually a doctor. He's a family doctor, a general practitioner. So he was the first example and a great example of what it means to be a doctor, where he really cares for his patients and he's very well loved and appreciated by his patients, not just because he delivers, but he really also cares for each patient personally and provides that listening ear for them in times of difficulty and illness. So with that example, I actually wanted to do medicine from a very young age, and I was blessed to have the opportunity to pursue it and met a lot of really good mentors along the way. And I was really fortunate to have been exposed to a very wide range of doctors in all fields of medicine. Then, having completed my undergraduate training, I returned to Singapore to work. I then was fortunate to be able to have a junior doctor posting in ophthalmology at a very early stage. So from there, I realized that I was very interested in the subject because in ophthalmology, there is a very good mix of both medical practice as well as a surgical practice. So although the eye is a very small organ, there are many parts to the eye, and it's an amazing organ with so many parts to it that the field in ophthalmology is very wide, but it's also very deep. And with the advancement of technology, we are able to do a lot through our microsurgery and through advanced imaging techniques. This has created a lot of very great progress in the field of ophthalmology in the recent years, but also with a lot of potential for further progress. So that was what drew me to the subject of ophthalmology. So the mission of the Straits Eye Centre is to provide quality eye care services for all and to make it accessible for patients to receive patient-centered care. So the majority of the patients that we see in our clinic usually fall into two categories, that are either the adults or the pediatric patients, so the children. So under the adult group, usually there will be patients who are either seeking care for general eye screening or comprehensive eye care for age-related conditions, and another group may come in for more acute symptoms such as for the red eye or painful eye symptoms. And then under the pediatric age group, which is the group that I subspecialize in, we usually see the children of all ages from very young, even at birth, all the way to teenagers. In the Straits Eye Centre, I see both adults and children in my practice. So for the adults, usually this would be general eye screening or eye checks for any particular acute symptoms such as blurring of vision or red eye or floaters, as well as detailed eye checks for any age-related conditions such as cataracts, glaucoma, macular degeneration or retinal conditions. In the pediatric population, patients that I see usually would be for vision screening, ensuring that their vision is good in both eyes and making sure we detect any condition that may affect their vision at a young age and treat it early. We also see patients with strabismus, which is misalignment of the eye or squint in lay terms, and these children will need also early intervention to improve the alignment of their eye as well as to treat them for any amblyopia, which is a lazy eye or reduced vision in one eye for any particular reason. In addition, I also see adults with strabismus, and we will perform tests and treat them accordingly in our clinic. A patient who's coming to our clinic for a full eye check examination, usually the first thing we let them know to be prepared that the testing may take some time because there are a few different stations that the patients have to go through. So typically, first we have to check their visual acuity, so how well they can see, and that's usually by using these vision charts. And then we may also check the refractive error, which refers to what the power in their glasses are or should be. So then following that, they usually see the doctor or myself to have a full eye assessment. And during this eye assessment, we will take the full history, of course, from the patient to find out more about what they are presenting with, what their past medical history is, whether they've had any eye procedures done or they've any history of eye conditions. And then following that, we will do a detailed eye examination. So the eye examination also consists of a few different parts. Usually we examine the front of the eye and then followed by the back of the eye, but that will involve dilation drops, which dilate the pupil so that we can have a better, closer look inside the eye and at the back of the eye and the nerves. So regarding the eye drops, patients often ask, what the eye drops involve and whether their eyes will be affected after that. We tell the patients that the eye drops will cause blurry vision for a few hours, and therefore advise them not to drive on the same day of the eye checkup. Because when the pupils are dilated, the vision will be blurry, especially for near reading, and they will find that the sunshine is very glaring. So in young children, we may also have to put eye drops depending on the condition. And these eye drops sometimes cause blurring for a longer period of time, not just 4 to 6 hours as in an adult dilation, but in a child, we put special eye drops to relax the focusing and to recheck certain parameters. So this blurring of vision or dilation of the eye will last a bit longer, usually about 24 hours. But of course, we will discuss this all with the parents ahead of time. I think that because I'm a pediatric ophthalmologist, I think that is something that not many people might know is that children of all ages can have their eyes checked even if they are not yet verbal, not yet reading well. But even at a very young age, we can do objective eye checks just to rule out any significant eye conditions or to detect things early that will allow us to make sure the child's vision develops well even as they grow. Yeah. It's the same for adults. Adults too have needs and concerns about their eye health. What I value a lot is the time that I can spend with patients, finding out not just about their eyes or their vision, but about the rest of their life, their occupational needs, their hobbies, what they do for a living, and all this affects how we provide personalized treatment for the patients. Yeah. I think the easiest way to reach us would be to find us on the website, which is Straits.com.SG, or to just Google Straits Eye, and you will be able to find our clinics there. We have a number of different locations. Our main center is at Camden Medical Center on level 6 and level 12, and this is very easily accessible now by the MRT, and we're just next to the Orchard Boulevard line. And we've also just opened another clinic in Parkway East Hospital called the Straits Eye Center for Kids and Adults. And we also have a few community clinics in Bedok, Clementi, and Toa Payoh. So the details of all the clinics and their locations can be found on the website, and our contact numbers are also on the website, both the telephone number for the landline as well as the mobile number, where patients can WhatsApp us on the mobile number to get a prompt reply for their appointments.